Hi, Don. How are you?
James, how are you today?
Good. This is our third, let's talk about Pharmacy Week opportunity here. And I think, to be honest, this is one of our best pharmacy years since you've been here. And we want to, first of all, thank you for your leadership and all the opportunities you've presented to pharmacy.
Well, I appreciate that, James, but it's the front line and it's those who care for our patients who deserve the credit.
Right. So looking back over the year, this year we had the opportunity to open up a new retail pharmacy, Ready Scripts, over in Ocean Pines. That's turning into a success. I think the leadership of that staff over there, reaching out to patients, reaching out to our primary care physicians, is one of the things that pharmacy does well. So
yeah, indeed, there's no question that the Ready Scripts here at the hospital, but certainly the second site at Ocean Pines is going to be a smashing success. I hear all the time how our patients just appreciate not just getting their prescriptions filled. That's the easy part, but it's the dialogue, the education, and the relationship that comes through the pharmacist and the team that is within Ready Scripts. So certainly the Ocean Pines project is exciting. We've seen great growth since it's opened earlier this spring, and really are excited about the future that's going to bring to that community, and likewise here at the hospital, we've not seen a degradation in the volume of the work here. So we want to grow the service, and I know Karen and Jeff and the whole team are focused on that as well. So
right.
I appreciate the hard work there.
So we're seeing real growth there. Our MTM program is growing as well with Jordan and under her leadership, and that's all good. As we kind of focus back toward the hospital, the inpatient settings, I think that group is doing outstanding work. We start with kind of what Anna's doing at antibiotic stewardship. We're finding ways to decrease antibiotic utilization. One of our outstanding ways of viewing that is to see C-dip. We're counting near 180 days and no C-dip in this hospital.
Yeah, it's phenomenal.
It's incredible.
Yeah, when we talk about zero harm and organizational excellence and high reliability, the pharmacy, the work that the pharmacy does is real critical in that effort.
Yeah.
And certainly Anna, the entire team, their work working with Mandy and you and the physicians on the floor to make sure that the patients get the right medications or not get the right medications is important to the work. So thank you for your leadership on that.
And that team is an incredible team involving a whole host of folks, including the medical staff, but also other clinicians here in the organization. Inpatient is doing very well under Michael Kiesman's leadership. We found ways to create what we call a 4-phase strategy in our playbook, and Michael found some medications, and I think we've done fairly well there. I think we've impacted in a positive way. We've lowered some of our purchasing. We've implemented a couple of new tools in the inpatient setting that we're also applying to the cancer center. One of those tools is a perpetual inventory. With that perpetual inventory, we're gaining insight into what do you have on the shelf.
Sure. Yeah, and it's, right, and I know the team, it's about managing costs and making sure that we have the right inventory to care for our patients when we need to, but also not carrying more inventory than necessary, which impacts on our capital needs, our cash needs, and so forth. So, that is the business side of pharmacy, and I appreciate what you and your team do every day in managing, what is a very high cost spend for the organization and getting higher.
Right. One of the things that, pharmacists end up doing is that, we have both of those hats. As I begin to kind of transition both of those hat conversations to the cancer center, there we face high cost medications. We're applying a couple of strategies there. We're going back and looking at biosimilars. In partnership with Dr. Paul, we've begun to implement biosimilars there. Same quality outcomes, lower cost. And that's been very, very good. And he has been incredibly supportive of our efforts there. So I just want to say, Dr. Paul, thank you.
Yeah, well, I think it really highlights and illustrates an important point, and that's the need for teamwork and partnership. That our pharmacists bring a level of expertise and information to help our physicians with their prescribing patterns and what makes sense or may not make sense, and it's the partnership and recognizing that we're better together and we work together to, try to improve care for our patients. We might at the same time bring the cost of that care down, and that's a good thing.
That's a
so
good
I
thing.
appreciate what you're all doing there.
It's a good thing for our patients as well. And the last thing I want to probably bring up, and probably should have been the first, is our level of staff engagement. We have been very fortunate to have one of the first career ladders in the organization, and we targeted our pharmacy technicians there. And they have actively engaged in this. I believe, if I have my numbers correctly, 6 of the 8 technicians have all engaged in getting onto the tier
awesome.
ladders. We have one technician who has moved to the advanced level. That same technician, we're fortunate to have. She now sits on the Maryland Pharmacy Association board. Just the level of professionalism in our technician corps is incredible. This year we're opening up the kind of career ladders to the pharmacists. Our goal there is to create kind of similar strategy, but we're asking the pharmacists to get certified through the various boarding processes that pharmacy offers.
Mm-hmm.
So we're looking for the same level of engagement, the same level of professionalism, the same level of being able to provide more help.
Yeah.
So that's a quick look at pharmacy. I mean, I could call out more individual names, but I think we have an incredible
Yeah, let me
pharmacy team.
just say, thank you to the team. Our pharmacists are an integral and vital part of the healthcare delivery team, and managing our patients, bringing information, as I said, to our clinicians, managing all the vast amounts of information, contraindications, the complexity of formularies, non-formularies, new medicines, biosimilars, all those things is an incredibly complex, undertaking. And our patients don't really understand that. All they know is that they take these medications and they somehow have an impact and they make them feel better or worse or what have you. But ultimately, it's important for their recovery. And your team and I'm looking to our pharmacy team do a phenomenal job. We are so fortunate at Atlanta General Hospital to have the depth, breadth, and quality of pharmacy support services that we have. And it's a testament to you, James, for your leadership and your guidance. And I have great confidence, when you come to me and you say, hey, I've got an idea, that idea has been thoughtful. We can't always do it for different reasons, but it's been very well thought through, and always with the eye towards how do we improve care for our patients, how do we improve the safety of the care we're delivering, and how do we manage the economic impact of these decisions. So I appreciate that. I appreciate the entire team. So happy National Pharmacies Week.
Right.
Pharmacist Week.
Happy National Pharmacist Week and Pharmacy Week. Thank you to all of the AGH Pharmacy team. Thank you
Great
so
work.
much.